Endometriosis is characterized by the development of tissue in other parts of the body that resembles the uterine lining. You may encounter uncomfortable sensations as a result of this tissue's unnatural growth, which may affect your regular activities. Your uterus's inside lining is called the endometrium. During your period, you shed this tissue. These layers detach from the uterine walls during your menstruation. The endometrium supports the initial stages of development during pregnancy. When you have endometriosis, endometrial-looking tissue develops on other organs or tissues. This tissue may develop in your stomach, pelvis, or bladder. As a result of its hormonal sensitivity nature, this tissue might swell up throughout your menstrual cycle. These patches of tissue that resemble endometrium cause scarring, polycystic ovary syndrome, and lumps in your body. Did you know that women between the ages of 25 and 40 are most frequently affected by endometriosis? Younger women may experience it during their adolescent years. 10 warning signs of endometriosis. 1. Painful menstrual periods. Endometrial lining often develops outside of the uterus, either underneath the uterus in the posterior cul-de-sac or around the ovaries. There is some internal bleeding as it forms and disintegrates in the pelvis. Scarring, edema, inflammation, and discomfort are the results of this. 2. Pain during sexual intercourse. If endometriosis is present in the lower uterus behind your vagina, having sex may be particularly painful. Endometrial tissue can be pushed and squeezed during intercourse by penetration and other motions, especially if it has developed around the cervix. 3. Discomfort while urinating. An individual often feels pain and discomfort in their abdomen and pelvis as a result of endometriosis symptoms. Due to tissues developing and sticking to the bladder, it can also result in excruciating urethra and bowel problems. 4. Heavy bleeding. Sometimes, you could have thick menstruation or bleeding between periods. Endometriosis causes fragments of the uterine lining to spread to other pelvic organs. Similar to ordinary endometrial tissue, the tissue swells and bleeds outside the uterus during menstrual periods. 5. Infertility. Endometriosis develops when the uterine tissue grows in areas where they are not supposed to, like the ovaries or fallopian tubes. Severe stage 4 endometriosis, which can result in scars, obstructed fallopian tubes, and impaired ovaries, in women. These growths can interfere with your ability to conceive by obstructing your fallopian tube or creating scar tissue. 6. Back and leg pains. The sciatic nerve, that runs from your lower back down to your legs, may be impacted in some cases of endometriosis by the inappropriately developing tissue. Pressure feelings as well as back and leg aches may result from this. 7. Fatigue and exhaustion. The body's efforts to eliminate unhealthy tissues can be a major consequence of endometriosis-related tiredness. This tissue secretes cytokines, sometimes referred to as inflammatory poisons, as the immune system works to fight endometriosis. These internal substances trigger the weariness that patients experience. 8. Diarrhea. During menstruation, the uterus and endometrial tissue emit prostaglandins, which can trigger contractions of muscles. This can lead to increased intestinal contraction, having an impact on the uterus. Consequences of these situations may include diarrhea and abdominal pain. 9. Constipation. Endometrium tissue can develop on the rectum, intestines, or in other areas of the bowel in cases of intestinal endometriosis, which might result in constipation. 10. Blood in the urine. When a lump from severe endometriosis develops on the inner surface of the bladder wall, the urethra may also be affected. Endometriosis is regarded as a severe condition. After surgery, many patients report pain alleviation from endometriosis, although the symptoms may come back after a couple of years. At times, endometriosis occasionally disappears on its own. Endometriosis nodules occasionally shrink with time, but some can remain. This can also occur after reaching menopause, which is frequently associated with a decrease in estrogen levels in the body. To manage symptoms like agony, endometriosis affects lots of women and requires ongoing treatment. Maintaining a regular visit schedule with your gynecologist can help you cope with your illness together. Let's meet in our next video for more educational tips. Remember to like, share and subscribe to our daily posts and videos. Thank you for watching.